Overview of a global campaign on prevention of asbestos diseases. I work for the Building and Woodworkers International, which is a global trade union that represents around 300 construction trade unions affiliated to our international, and they represent around 12 million members in construction. And you can see this little poster from the Building and Woodworkers International. In 1989, the BWI adopted the policy to push for a complete global ban on all uses of asbestos and asbestos-containing materials. But asbestos is still not banned and is killing around 107,000 people every year from their past exposure to asbestos, according to the World Health Organization. So despite everything that we know and now a clear international scientific consensus, the asbestos industry is still a very profitable one, and there is an increasingly aggressive marketing campaign in developing countries, and it's here that we have a public and occupational health disaster in the making with new asbestos exposures every day. If we look a little bit at the situation now in terms of the global picture regarding asbestos. In green on this map, you can see the asbestos-free countries, which were all very heavy asbestos users in the past, and all today with devastating health impacts, with asbestos death rates higher than all road traffic accidents and all other causes of occupational deaths put together. For example, in the United Kingdom, there's around 4,500 people dying each year as a result of past exposure to asbestos. In red, we see the heavy using countries, and you can see Brazil, Mexico, Russia, Kazakhstan, China, India, and others there. World asbestos production really took off in the 1950s and reached almost 5 million tonnes in the mid-1970s. And it was about that time that it began to become really obvious that it was causing cancer and that it was very difficult to control occupational exposures. And several nations began to introduce bans. And by 2006, you can see that world asbestos production was down to around about 2 million tonnes. And for the moment, we appear to be stuck at that level of global production at around 2 million tonnes, 1 million tonnes of which is produced in the Russian Federation. So how has this happened? If you look at the blue column, that shows our 5 million tonnes in 1975, and in 2006 our 2 million tonnes. But what is very remarkable is the red column, which is the industrialized countries, then very heavy users, and today very little. The red column in 2006 really represented Canada, which has since ceased its mining production operations, at least for the moment. And today, the situation is completely reversed. In the mid-70s, developing countries were using virtually no asbestos, or very little, and that's where the marketing and use is focused today. And if you just look a little bit at India as an example, you can see in 1950, they weren't really using much asbestos at all, not compared to the industrialized countries. But by 1990, that situation had completely reversed, and you can see as India has been targeted and has found that it's a very cheap and versatile material, they're today importing almost 500,000 tonnes a year and increasing year on year. And these are the kind of conditions that we see that people are working, handling raw asbestos in India, living and working on construction sites using asbestos, handling raw asbestos, with really no protective measures at all, and no information about the hazards. And on the contrary, a lot of misinformation about the hazards. So our campaign then, we have 4 action areas. Firstly, to address the global marketing campaign. Secondly, to work with importing countries on the need to use alternatives to asbestos. and to have a just transition to new materials. Thirdly, to protect workers and the public from exposure to asbestos. And fourthly, to promote the rights of those who are affected and made ill and die as a result of their exposure to asbestos. And we have international tools to work with. I don't expect you to be able to read these slides, but just to point out that in 2006, the International Labour Organization and the conference made a resolution on asbestos, and it calls for the elimination of future use of asbestos and proper management of asbestos already in place. And it clarifies that the Asbestos Convention 162 should not be used to provide a justification for or endorsement of the continued use of asbestos. So that was a very helpful clarification. The International Social Security Association is working worldwide to promote a ban on the use of asbestos. So is the International Association of Labour Inspectors. In 2007, the World Health Organization, together with the International Labour Organization, produced a document that is extremely important for us, and we are using this document all the time in all countries. It's a national action plan for the elimination of asbestos diseases, and it has as its basis setting up tripartite or multipartite national team that look at what can be done, how much asbestos is being used, finding out where it is in buildings, and looking to phase out or eliminate the use of asbestos and provide justice for the victims of asbestos. But as we were making these breakthroughs in 2006, the industry, the producing countries, began a bit of a backlash, led by Canada. They began visiting every country that was considering introducing a ban on asbestos and deliberately setting up these so-called scientific symposia to say that Chrysotile is radically different, much safer, no problem, you can use it very safely, and confusing and interrupting progress towards a ban in many countries. This particular one was in Indonesia, with an invitation to a networking cocktail at the Embassy of Indonesia. They also, in 2006, had in Montreal a big international conference on Chrysotile. They have a number of paid scientists for the industry as well who were present at that conference and making an action plan to defend the industry and expand the use. Brazil spent a lot of money, Eternit and the Chrysotile Association, on a huge marketing campaign, advertising campaign to defend the use of asbestos, which of course they mine and export. And in the Russian Federation, their view is that Chrysotile asbestos saves lives, and they have quite a vigorous campaign and have really taken over from Canada lately in being the leaders of the campaign to promote the use of asbestos. So just a couple of examples I wanted to mention about the International Chrysotile Association. We're pretty close to a ban in the Philippines. We set up a national board on elimination of asbestos diseases, parliamentary bill, lots of support. But the industry is there. They had a big conference in Manila last year, sponsored by the International Chrysotile Association. And they've set up an International Chrysotile Association in Philippines and in India and in Indonesia and in Thailand. And there was just a big junket visit a couple of weeks ago by Filipino decision makers to visit the Brazil Eternit factory. So this is ongoing. Similarly, in India last year, big conference in New Delhi, again organized by the same producers and the International Chrysotile Association. Last month, the government of Zimbabwe, assisted by the Russian Federation and the embassy in Zimbabwe, brought out a position paper and their plans to reopen two asbestos mines, and citing again the ILO and the WHO positions as being in favour of using asbestos, which is not correct, and the WHO and the ILO are acting on that at the moment to ask the government of Zimbabwe to clarify that. So the asbestos industry has a lot of money and a lot of resources. They've also created some company unions in asbestos-producing countries, and they're hampering progress and initiatives towards a ban. And we really need to be active and support decision makers and really campaign to share our experience about asbestos and the hazards. The other big area that we're working on is on asbestos cement substitutes, and we're working with trade unions, companies and governments on transition to alternatives. Product costs are higher but cheaper than the costs of continuing to use asbestos. It's a new plant, Brasileic plant in Brazil. Very important area is protection of workers. There are billions of tons of asbestos contaminating those countries that have already banned, so it's still an enormous problem. And as I mentioned, of course, lots of new exposures. So we're doing a lot of training and getting information out to people that need it. There's a lot of very good materials around. The European Federation of Building and Woodworkers has some excellent materials under our campaign, Asbestos Still a Killer. There's also very good guidance, very detailed guidance from SLIC, from the Senior Labour Inspectors Committee in Europe also. And final is the rights of those who are affected, so pushing for health surveillance, medical advice, treatment, legal advice, compensation. And we're working in coalitions of trade unions and victim support groups along with sympathetic professionals all around the world. So we really need to push on the national action plans. We're really taking ILO WHO as our key document. It has everything in there that we want to see, and we really need to take it and use it and to get as many people behind that initiative as possible. So we're working with our affiliated trade unions on their institutional participation at government and national level, as well as at workplace level with health and safety representatives and health and safety committees, and doing a lot of networking, lots of demonstrations, letter writing, petitions, working very much in coalition with other groups, in particular the International Ban Asbestos Secretariat and all of the victims associations that they group together. And it's a very powerful alliance, I believe. So lots of activities going on around the world. So this is a photo from May this year, taken in Vienna. We had a big conference on asbestos. There was 115 delegates from 41 countries, all coming up with some new strategies. And I'll share some of the conclusions, although some of the information is a little bit more confidential. So we're looking at creating a database of international companies that are profiting from asbestos operations to assist investors who want to make ethical choices, and in particular we're looking at workers' capital. We're working with construction and cement industry partners as well as financial institutions to stop using asbestos. We're exploring further options for criminal prosecutions. I'm sure you're very aware of what's coming up with Ethernet soon. And really delivering new resources and materials, updated information to ban asbestos activists, and we have a lot of new information in the works. And to continue using the ILO WHO outline on national action programs to eliminate asbestos diseases. And if you're not familiar with that document, please just Google it, get it, and start thinking how you can use it. So really to push governments to act. And the final thing that we're doing this year and next is we're going to be doing some naming and shaming of industry, scientists and lobbyists. So thank you very much for your attention, and it's given you a rough idea of what's going on just at the moment. Thanks.